Hi, everyone. My name is Jessica Milanes, and it is an honor to have been chosen to share my story with you today. A little bit about myself. I'm currently 29 years old, and I grew up in Foster City, California, which is located in the heart of the Bay Area, and I currently live in San Francisco. I love food and eating, cooking and baking, and I currently work as a pastry chef. And here's a picture of my family, my parents, and my brother. So I was diagnosed with myasthenia gravis in 2006 when I was 13 years old. At the time, I was really active. I was playing basketball for the local Japanese league, and I had just picked up golf as well. And I also had just received my black belt in Taekwondo. I have a couple of very distinct memories of early weakness during this time. The first memory was out at a restaurant with my friends Erica and my mom, and trying to eat a burger and really struggling to just get my mouth open, and then also just the chewing and swallowing part of it. And then the second memory I have was going to basketball practice on a Friday evening and not even being able to lift my arms up to pass the ball and to catch the ball. And so we definitely knew that something was wrong once we started seeing those symptoms. I was fortunately diagnosed pretty quickly, but I wasn't treated aggressively enough at the time. And so early on, I had caught a common cold on a Friday evening, and then by Sunday it turned into pneumonia and my lung collapsed. And I was in the hospital for a couple of weeks, just dealing with that and with a new diagnosis. And it was at that time that we were paired with Dr. Jonathan Katz, who is still my neurologist to this day. So he's been with me through this whole journey. So after being diagnosed in 2006, I started high school. I had relatively little symptoms starting high school. I was able to play sports. I played basketball and golf and one season of softball. And I played sports throughout high school. And my last 2 years, I played golf and was actually the MVP and the captain my senior year. During this time, I didn't really struggle with the myasthenia that much. The most inconvenient side effect I did experience was having to use the bathroom a lot, just as a side effect of the medication. And so I often had to leave class to use the restroom. For college, I was accepted to South Barcelona in LA. We were a little bit worried about me going away for college, but fortunately, this is actually the time that my myasthenia was the best. I would say that I was pretty much in remission for all 4 years of college. I had very little to no symptoms, and I took very little medication during this time. And so I was really able to enjoy college to the fullest. I was a part of a lot of clubs. I was a treasurer, events coordinator, and then eventually the president of the martial arts club, which is the picture in the top right. I worked as a teacher assistant for the student-run restaurant, and so the bottom picture is me teaching some foreign exchange students that we had how to make fresh pasta. I was also voted Teacher of the Year for Zeta Phi Rho, and I was a part of an honor society. My favorite memory from college was having the chance to study abroad in Italy. Taking cooking classes in Italy was one of my life goals, and it was really exciting to be able to do that with a lot of my classmates. I also graduated in with a degree in hotel and restaurant management. Towards the end of my last quarter of college in 2014, I started noticing some symptoms again, weakness, and it just I could feel it coming back. And you can kind of see in this picture at my graduation, my eyelids kind of was drooping, and I had a hard time smiling. By the time I moved back home in June of 2014, I was fully in a relapse. Um, Up to this point, I had been on or tried methadone and prednisone in varying doses, Cellcept as well, and IVIG. And I also had an allergic reaction to Immuran early on in my diagnosis, so that was not something that I took. But it was a pretty severe relapse. I also started experiencing new symptoms that I had not experienced before during this relapse. It was my first time experiencing diaphragm weakness and trouble breathing. I actually spent a lot of time in and out of the hospital between 2015 and 2017. I was in the hospital one year for Thanksgiving and Christmas, and one year I caught the flu pretty bad and had to be intubated actually twice during this stay. This relapse was probably one of the hardest things that I've gone through with myasthenia to date. It was in my early and mid 20s, and so it was really hard on me mentally, as well as physically, but a lot so mentally. Um, just missing out on a lot of activities and a lot of, things, bachelorette parties, concerts, birthday parties, even hanging out with my friends on Friday, Saturday nights. It was just really hard to miss out on those things. But a couple positives of the relapse were that I started plasma exchange. I would go into the hospital and they would put the port in my neck, and then eventually I just kind of put in my chest for about a year and a half. And then in 2017, I got a fistula placed in my right arm. And so, um, we learned about this new treatment that I hadn't had before. And so that was really a positive of this. I would say another positive to this relapse was that I learned the most about my body with myasthenia during this time, having experienced all these different symptoms that I hadn't experienced before, and also just navigating hospitals and insurance, and advocating for myself. I really learned a lot through relapsing. In 2016, I learned about the Stanford Palo Alto Support Group, and we attended the group, and it was actually my first time meeting another person with myasthenia, and it was 10 years after my diagnosis. And so this really changed my life and kind of how I saw myasthenia and how to cope with it. I'm sure as many other people with myasthenia can attest to, talking to someone else that just understands what you're going through, understands the medications, and when you're feeling weak, without having to explain it to someone is really important, I think, and very beneficial to your overall just well-being. And so I'm so thankful to have found the MGFA and support groups during this time. And in 2015, we participated in our first night MG walk. So here's a picture of our team, my friends and my coworkers, my family. And then this was in either 2017 or 18. It's just really been fun to do these walks in person. I definitely miss that. Just getting all the friends and family together and just seeing how much support there is for you and for those going through myasthenia. Through the MG walk, I met Sam Gardner and Dova Levin, and these two women were very instrumental in getting me involved with the MGFA. In 2018, I was chosen to be the hero for the San Francisco walk, and so I got to share my story then. In 2019, I was asked if I would like to lead the San Francisco walk, and so I took that on. And ever since then, I've been helping lead and organize the local San Francisco walk. During the 2019 walk, I realized that there was not a support group in San Francisco, so I started the San Francisco support group at the end of 2019. And then in 2020 and 2021, I got involved with Maya, which is the My Media Advocacy for Young Adults group, and I've been helping to lead their virtual meetings in this past year. And in 2021, I was given the honor by the MGFA of the Emerging Leader of the Year award. So it's very nice to have my efforts recognized. I'm also very thankful for these performers, not only to lead them, but to be a part of them. They've really helped me tremendously in not only connecting with other nice new patients, but just for myself, it's always nice to just to talk and with other people who know what you're going through. I kind of wanted to talk about some of the treatments that I've tried since I've had my CNA for a long time. I've had the opportunity to try a wide variety of the medications and treatments that are available. In 2019, I tried Solaris. Unfortunately, I missed a couple doses due to illness and insurance issues. But overall, I felt like it was working, but just due to the mixed doses, I think that kind of didn't really help with the efficacy of it. I also started getting weakness in my legs in 2019, which wasn't something that I had experienced before. So by the end of that year, we switched back to plasma exchange because that's just kind of what's been most effective for me. At the end of 2019, I also had a thymectomy. We felt that I was healthy enough and strong enough to go through with the procedure. Unfortunately, there was a complication with the thymectomy. It started out as a video-assisted thymectomy through my side, but they had hit a nerve, and so unfortunately, they had to finish the surgery through my sternum. But everything was taken out, and so in the end, it was a successful surgery. I'm not quite sure if the effects are helping yet of the surgery. In this past year, I've been pretty stable. I've been on a low dose of prednisone pretty much through my whole diagnosis, but more recently, a low dose. I take Mexicon during the day, and I've also been getting weekly plasma exchange. I started using a BiPAP after my thymectomy. I just noticed that I was having a pretty hard time breathing laying down, and so that really helped get me through the last couple of years. And this year, I actually have not been using the BiPAP, which is a great step forward. And exciting to announce that I hopefully will get to start the new treatment that was recently approved by the FDA soon. I'm just waiting on a couple things, but so hoping to move to my new treatment instead of the weekly plasma exchange. I wanted to share some of the achievements that I've had in the past few years. I think it's easy with my seniors to focus on some of like more of the treatments and how it's maybe negatively affected you, but I just kind of want to share what I've been able to achieve with my senior. I attended the San Francisco Cooking School and their baking and pastry program in 2018. Attending cooking school was also another one of my bucket list things to do, and so I'm proud to say that I did that. My externship with the cooking school was with the food stylist Jeffrey Larson, amazing man. We worked on his gluten-free baking at home cookbook, and I did the recipe testing, developing, and was his assistant food stylist. And this is another picture of me with my brother at the cooking school. Here's some examples of the work we did during school. And I'm happy and excited to announce that the book that I worked on with Jeffrey Larson actually won a James Beard Award in 2020 and also an IACP International Association of Culinary Professionals Award in that same year, which is quite a high honor, James Beard. So, not something we were expecting, but it's very exciting to win. I actually based a lot or almost all of the items that were shot in the book. So if you ever get the book, you can see some of the work that I've done. Right now, I currently work as the pastry chef at my family friend's ice cream and frozen yogurt shop. I oversee dessert production as well as work on or help with a lot of the graphics design and the menu design as well. Um, my favorite part of this job is working with customers on their custom cakes. We do custom frosted and ice cream cakes, and it's just really fun to make um, little creations for people to enjoy. And I also do freelance recipe development in my spare time. Here's some examples of cakes that I've done. The left is an ice cream cake. The right has fruit in it. I do wedding cakes and custom birthday cakes, and also a lot of kids cakes and baby shower and smash cakes for babies, which is a lot of fun. Kids cakes are my favorite, so it's great to see the kids' reactions to the cakes. Just want to share a little bit of what I've learned through my diagnosis with myasthenia. I think the biggest part, or the biggest thing that I've learned is how to listen to your body, especially when you need rest. It can be easy to, try to do all the things that you want to do, but sometimes that's just not possible for us with MG. And so I've really learned how to say no and not feel bad about saying no. Missing out on parties and things like that. It's hard, but just I try not to focus on the missing out part and more about getting rest and then all the things that I'm going to be able to do when I'm feeling healthy. And so not worrying about missing out is definitely something that I still work on. It can be hard with like social media to see, your friends and everyone, people your age out and having fun and living their lives. But I think it's just important to remember that, your health is first and all the fun stuff will definitely come later. I've also learned that it's okay to ask for help. With myasthenia, there's a lot of things sometimes that you can't do. During my relapse, I was particularly having trouble with like bathing myself, taking a shower, washing my hair, changing, fixing my hair, brushing my teeth, just all these things that we take for granted. And I really relied on my mom during that time. And I always felt bad asking her for help, but it's just something that, the people that really love you and care about you, they're not going to see it in a negative way, and they'll be willing to help you out. So just learning that it's okay to ask for help. I've learned that I've learned the importance of building a support network, people that you can go to talk to about, what you're going through, that people that understand, whether it's your family and your friends or others with myasthenia. I think it's just really important to build a support network and not feel like you're alone, because I feel like a lot of times with this disease, being so rare that we can feel like we're doing it alone, but you're not alone. So building a support network is very important, I think. I think focusing on emotional health is important too. As much as we talk about these, how to treat your symptoms, how to live day to day with your symptoms, emotional health is something that might not come to mind when you're thinking about caring for your MG, but it's really important, and it really does affect, your mood and how, even your symptoms. If you're stressed out emotionally, that can be a negative impact on your symptoms. So really, taking the time to make sure that, emotionally you're okay, because dealing with myasthenia is a lot. So emotional health is very important. And then just staying hopeful, there's a lot of treatments and medications that are out now that weren't available, even when I was first diagnosed or, 5 years ago. And so seeing all this research that's being done for myasthenia, and the awareness for it, and just being more well known, you go to the hospitals and more nurses know about myasthenia, it's all the more reason to stay hopeful that there will be a cure and more treatments coming out. Before I end, I just wanted to quickly say thank you to the people that have been instrumental in my journey with myasthenia. All of the tons of doctors and nurses and hospital staff, that I've encountered during my journey. And I can't thank you enough. The staff at the infusion center where I got my plasma exchange, they've really been important in getting my weekly treatments scheduled on time and correctly. And so I can't say thank you enough. To my parents, my mom and my dad, my mom especially, she was a big part in my relapse and just making sure that I was being taken care of. Everything from, like I mentioned earlier, basic grooming needs and changing to keeping me company on the weekends when I could out with my friends, binge watching our favorite TV shows. So just thank you from the bottom of my heart for everything that you've done for me and now during that time and now to this day. To my dad, my golf partner, just thank you for being by my side, for driving me to all the corporate meetings, just being a real support for our family. To my grandparents, my grandma, my grandpa and my grandma, especially my grandma who takes me to my treatments when I can't drive myself, and then feeds me after and nourishes me with her home cooked food. I just really appreciate that. To my brother Jason, just one of my favorite people in this world. He always knows how to make me laugh or smile, and so just very appreciative to you, Jason. To my boyfriend Chris, I feel so lucky to have found someone who is so kind and caring, and just willing to learn about myasthenia and willing to, just do what I need to get by. So, we've been through a lot in the past couple of weeks. I was actually in the hospital with a respiratory illness, and he was there taking care of me, picking up my prescription. So thank you to you, Chris. And to my family and friends who always check up on me and just make sure that I'm doing okay. Um, you know, we would not be able to get through this without your support. So thank you to you. And again, thank you to the MGFA for allowing me to share my story today. It's been quite a journey, and I know that there's more ahead, but I'm just thankful that I found the MGFA and support groups through the MGFA to help get me through this. So thank you, and if anyone ever wants to reach out, I'm more than happy to talk, or if you'd like to join the support group, we'd love to have you. So thank you, and have a great rest of your conference.
Hello, I'm Jenna Mvalo, and I'm the National Director of Patient Advocacy and Community Engagement at the MGFA. I'll be introducing our next speaker, Dr. Hafer-Macko. Dr. Hafer-Macko is an Associate Professor of Neurology at the University of Maryland School of Medicine and the Medical Director of the Myasthenia Gravis Center at the University of Maryland Medical Center. She is recognized for her personal commitment and contributions in supporting the work and vision of MGFA and serves on the MGFA Advocacy Work Group. She has extended her extensive research interest to clinical research trials of exercise rehabilitation for individuals with neuromuscular conditions associated with aging, including myasthenia gravis. Dr. Hafer-Macko will speak to us today about how to be an MG advocate.
Much for inviting me to talk to you today about something that's very dear to my heart, and that's how to be an MG advocate. Before, let me advance. Here we go. Before we begin, I'd like to introduce our team. You just met Jenna Malvo, who's the Director of Patient Advocacy and Community Engagement. And on the right hand of the slide is Kim Eldridge, who co-chairs the Advocate Working Group and is on our MGFA. can you hear me? It looks like my picture went red. As a way of an outline for this advocacy talk today, first and foremost is learning how to advocate for yourself. Second, what I wanted to talk about is building an advocacy network, which starts with family, friends, a caregiver, and then your care providers. We expand that to have a network of support like our MGFA support groups, the MGFA itself, and our industry partners. As you will see in the exhibit, many of them have helped sponsor this meeting and really have helped us with advances in myasthenia care. And then finally, we'll talk about what can you do on a local, state, and national level at DC for advocacy. So first and foremost is yourself. And how do you take charge of your own health care? Well, first and foremost, you want to be informed. And that includes getting information on what the myasthenia symptoms are, and then actively participating in your health care. When you see your physicians and your care providers, it's very important to communicate clearly and accurately. And what that means is really thinking about what your myasthenic symptoms are. The doctor will ask, so what are your MG symptoms like? And as you know, there are so many variations in how your MG presents. So you want to give them the range from your best to your worst. You want to think about how medications like Mestinon may impact your symptoms, and is it providing enough benefit? How long is that benefit? And then if you're on immunotherapies or different procedures like the IVIG infusions or the plasmapheresis, how long is that benefit, and how does that impact your MG symptoms? And when we think about MG symptoms, we want to think about how they impact your day-to-day life. So with the vision, you want to think about and communicate how that affects your ability to read, watch TV, drive. How does it impact dressing, grooming, at work? What are the limitations that you may have that we need to address to help you achieve the things you need to do? And at home, meal prep, house cleaning. These are the things that, because of the fatigue, may be impacted. You want to build trust and mutual respect with your care providers. So when you come in, you want to have a list of your medications. You want to have what you need for refills. And then to make the visit more streamlined, have your list of to go. And very importantly, as you have heard with our emergency care and management for myasthenia, you really want to have an emergency plan. So if you need to go into the hospital in a crisis with troubles breathing or swallowing, you want to make sure you have your list of meds. Do you have your emergency contacts and have a plan ready? And then you want to build your support network. And then next, two heads are better than one. So we want to build support means is having family see. So they able to see things that you can't. Your eyes start drooping, if you start having facial weakness, maybe your posture's changing because you're getting weak, or you're having more trouble breathing or speech starts slurring. And what I suggest is take their input, because that's going to provide a more complete picture when you talk to your physician. When COVID pandemic ends and you can take family members in with you, what I suggest is that you listen, communicate with your care providers, and then your family or friend can take notes and have a list of questions so you team listen, because then it helps as you recap and summarize the visit to have that plan formalized. And the other thing is those family and friends know you. They can help you set realistic goals. Because of the fatigue, everything takes much longer with myasthenia to accomplish. So helping to prioritize those things that you'd like to do. And then what we'd like to do is they can help you optimize things at work. How can we have you best succeed? At home, can they take over some of the tasks that you can have a little personal time? And then I suggest family and friends help in the time of MG crisis. Because at that time, because of the crisis, you may have trouble to talk. You may have trouble managing saliva, and you may have slurred speech. So if they can present the bigger picture, you listen intently and then provide the details so they can help you at those times. Next in our care team that helps to advocate for you is your care providers. So how can they help you? So first and foremost, you need to help keep them informed of any healthcare changes because they're going to impact your MG and MG may impact them. They may help you set realistic goals for work, and they may help with strategies such as work and school accommodations, requesting insurance approvals, the pre-auths, the denials, the appeals. They will be able to provide useful links on the MG resource page, which includes not only education, but also resources with mental health, so a number of items. Also, your care provider may be able to help after your care provider may be able to help in a crisis. After you've called 911 because you're having trouble breathing or swallowing, that's the time to reach out to your neurologist, and they can help in the emergency room to really develop a crisis plan. They can help devise a safe anesthesia and procedure plan, as well as the care after surgery or procedures, not only just for the thymectomy. They can help devise a plan for pregnancy and other things is to help you live your best as you can. So having things like parking, disability parking, those work and school accommodations. If you're dependent on non-invasive ventilation like BiPAP or the trilogies, then having you be a high priority on the electric grid, it really can be beneficial if the power goes out. So how does MGFA advocate for you? And I really like this. This is from the mission statement and the strategic plan. So first on the mission is creating those connections. And so with the resources they have built a resource network to improve your care, the access to care, and they've built a nationwide support group network. In enhancing lives, they are doing this through awareness, advocacy, education, and community building. Improving care through professional outreach to improve time to diagnosis. As many of you know, you've seen many specialists trying to get the diagnosis of MG, and that can take years in many specialists. I'm on yellow. I don't know if that means I'm okay. Okay. I hope you can hear me. So also they're trying to reach that cure for MG by spearheading and supporting promising research. MGFA advocate for your MG. Can you help advocate for your MG community? Well, you can join one of the MGFA support groups. You can become an MG friend. And I encourage you all to join the MGFA registry, because that really helps us get that patient data to see where our gaps in care and outreach are. What can you do locally? Well, you can share your MG resources with those people that help care for you, like the emergency room, taking the emergency management, reaching out to your paramedics so that they know about you before crisis. Your dentist, there are a number of tips for managing many of the oropharyngeal weakness, and then taking those to your primary care, and especially those drugs that you need to use with caution. Those are so important to have in your chart. You can volunteer at your local professional skills when you're feeling well, because your journey will make a difference. Those first patients that we meet in our careers really stand out, and they'll remember you forever. So we want them remembering about MG. Share your story. Reach out to newspapers, TV channels, and use your talents to fundraise and raise awareness for myasthenia. And then on the state and national level, June is our MG Awareness Month. I don't know why I put MS, so that is a bad typo. You can have a state proclamation, and then reaching out to your state legislators as you have troubles with achieving and reaching those new drugs that are just waiting for the myasthenic population. And then how does our industry partners help us? Well, there's a number of initiatives that they've helped in listening to the patient story, understanding the gaps of care, and where patient-centered priorities are. Many of these came through our MGFA registry. The MGFA has devised an international consensus guideline for MG management, which is now going to need to be updated with all the new therapies out there. Access to both the medical as well as nursing and other professional scientific boards through MGFA. And the other thing is having standardized clinical and biologic outcome measures, which the MGFA helps sponsor. And so with these drug trials, we have standardized tools. But we also need to understand what's meaningful to patients in terms of their outcomes. We want to design trials that have effective recruitment strategies, limit patient burden, and have meaningful messages. And with access, they get expertise in myasthenic, the scientists. They build the referral network with pre-screened qualified patients so that trials can run more efficiently. And through the Rare Disease Network, we now have MGNet, which is promoting research and has partnered with many of our MGFA physicians and scientists. So the final two slides will be on how we can advocate in Washington and locally. One is the orphan drug tax credit. This came out in 1983, and what it wanted to do was incentivize pharmaceutical companies to build safe and effective drugs for small disease populations. It's not like cancer, it's not like diabetes, but having an incentive for our rare diseases and improving seniors' Timely Access Care Act was to improve transparency and streamlining that prior authorization for many of these high costly therapies. And what Medicare does, many of the other insurance payers follow suit, making sure that we support NIH funding for neurologic initiatives, as well as rare diseases, which MG qualifies. Speeding therapy access today, the STAT Act of 2021 helps not only develop and provide access to these therapies, but also trying to identify the barriers to being able to use those therapies for patients who need them so desperately. And then partnering with American Academy of Neurology, there are several other issues. One was to avert the Medicare cliff, where Medicare had planned a 10% reduction in coverage of costs. And we know where those, when the insurance doesn't pay, then the payer ends up swallowing that. They increased telemedicine access. And first, they developed an affordable broadband infrastructure so more people could have access to telemedicine, and then worked on legislation to help telemedicine be more available to the public. They permitted Medicare to directly negotiate some of the prescription costs, and that's pending in the Senate. And then the next one is the inclusion, diversity, equity, anti-racism, and social justice ideas, which was to help affordability and access to those people who really need that. So, of disease, one of the things that I like are costs. The things that came out of the rare disease advocacy on the Hill was looking at the cost of having a rare disease. And what I find very interesting is if you look at the direct costs, which are on that only accounts for about 40% of healthcare, which means there's a number that aren't covered. Direct costs include your in and outpatient care, prescriptions, I do apologize. The indirect costs, which account for 45%, include absenteeism from work. Also, not only the person being absent from work, but often the caregiver. The need for modification of the workplace, the need for disability or retirement early, and then the reduced ability to participate in the community or to volunteer. And then non-covered medical costs include home and auto modifications, transportation for double vision where you can't drive safely, the need to pay for care, modifications to diet such as the Ensure and medical supplements, and then just the uncovered costs. So what can you do? So we invite you to partner with the MGFA as we partner with rare disease legislative advocates on February 22nd through March 2nd this year, which is coming up. And today is the last day to register. And with this week of activities, you'll be educated on some of those messages on the last two slides. And we have links to this on our advocacy page. So you'll be educated on the federal legislative issues. You'll meet other advocates with rare diseases across the country. And what we invite you to do is share your MG journey, your health issues and concerns, and how you can take those and help improve the MG care across the country as you talk to your state legislators. And we'll have a link to the registration on our webpage. And what we would like to do is meet with the MGFA advocates so that we can provide our infographics and talk about the issues so we present a unified front in DC. So let your voices be heard, and I'd like to thank you and open for the question and answers. And I do apologize about the connection.
Doctor, thank you so much for your time today. We really, really appreciate it. Really just a couple of questions here, which are important. One of the attendees are asking, what can we be doing about ensuring insurance coverage for MG treatments? What are some of the things we can do?
Well, and that's one of the things that they're trying to work on a national level, is making sure there's more transparency with those prior authorizations. And last year at the national meeting, we did dealing with those insurance denials. So one of the things that's important as a patient is that you clearly communicate how your MG impacts your disease, and having writing a separate letter, and what we want to do for patients on describing why those medicines are so important, and then sample letters for physicians that can be tailored to the appeal process. And then we just want to make sure there's more transparency down in DC and address the barriers to care.
That's great, Doctor. The last question is, what are some of the tips and tricks in building building trust and building better communication with healthcare providers?
I think, coming in, I think being very streamlined. Unfortunately, our visits are much shorter for both new visits and for follow-ups. So as much as preparation as can be done before a visit, and then after the visit, providing additional information, I think is very helpful. So that's why I spend a little more time on advocating for yourself, is coming in very prepared with data so that we don't have to repeat tests, and to really represent each patient well as a physician.
That's great. Doctor, thank you so much. If any of the attendees want more information about Virtual Rare Disease Week, you can go to the MGFA website, it's myasthenia.org, and you can go to the Get Involved link on that page. It'll take you to MG Advocacy, and there's information about Rare Disease Week there, which is really great. It's a wonderful event every single year. Really, really exciting time. And again, Doctor, thank you so much. We really appreciate your time today. And coming right up, we'll see a sneak preview.
Thank you.
Imagine stepping into a completely one-of-a-kind virtual neighborhood where the MG community can join together, connect, share ideas and discoveries in real time no matter where you live, and access MG educational materials such as live broadcasts, webinars, and informational libraries, all in one place. Now imagine entering unique online buildings such as a wellness center to access nutritional information, chat about recipe ideas, sign up for wellness presentations and live fitness expert workouts, and learn about physical fitness tips. Or visit our Welcome Center in the Town Hall to learn how to get involved with the MG community through our programs, patient advocacy, fundraising, and becoming a volunteer. Learn about the history and evolution of the MGFA and the MG community through the years in the on-site museum. You can access a whole host of educational materials and urgent care information, and chat about the latest research while viewing our research webinars in the Nancy Law Patient Services Center. become part of the Founders Wall by supporting the MG community or give in memory of someone you love in our memorial garden. And corporate partners can own real estate within the Industry Center to display and offer educational materials and informational links to all members of this online community. This graphically oriented online space will display all the charm of a small town with the combined power of the MG community through chatting, sharing, networking, and learning. Stay tuned for the MGFA online community official ribbon cutting in the coming weeks.